Okay. So there are total 3 pages, Dr. Sumaya.
Okay, ma'am.
And you started your time.
Next page. Next page. First page. Shall I start, ma'am?
No. 1 minute is there. Take your time to organize your thought process.
Okay.
Start.
Hi, I'm Dr. Sumaya, one of the doctors in the clinic today. May I confirm your name and age, please?
Yes, I'm Kumasi Alais and I'm 25-year-old doctor.
How may I address you?
Yeah, Alais is fine.
Alice, I've read from your GP letter, and what I've understood is that you have been referred to me because you delivered 6 weeks back and you are having some problem with the sexual intercourse. Is that right?
Yeah, doctor, it's very difficult. I'm really traumatized and I don't feel like doing anything. And that's the reason I'm here.
I can understand, Alice, and surely I'll address all your concerns. Since we are meeting for the first time, I would ask you a few questions to know more about you, and then we can make a safe management plan. Will that be okay?
Oh, yeah, that's okay, doctor.
So, Alice, tell me more about your concerns in detail.
Doctor, 6 weeks back, I delivered actually. It was a difficult, traumatic delivery for me. And after that, I am really having a trauma of inserting anything inside my vagina. I tried to have a sexual intercourse with my partner, but I just freeze. I don't know why.
Um, I can understand must be difficult for you. So, recalling the past events may be traumatic, but, but I would like to ask how was the labor and delivery? Was there any instrumentation done on you?
Yeah. So yes, doctor. As you are aware that I delivered 6 weeks back, and this was my first pregnancy. I went into labor. It was a prolonged labor, pretty prolonged labor. They started me on oxytocin drip, and baby was a little bit big. My baby's weight was 3.6 kg. I took so much of time to deliver the baby and to just help me out. They used ventus, okay. With the hentus, I had a very deep down tear. Okay, it was not extending to my back passage, but the tear was very deep, and they need to suture it. There was some bleeding extension, so they had sutured it inside the theater. Even my baby didn't cry. The baby was also being taken to the NICU. He was observed for some time there. So overall thing was very traumatic. Although the uh, tear healed, the midwife who checked me in the community, she said that it has been healed, but I am still getting nightmares. I'm still feeling it very painful, doctor.
So sorry to hear about this, Alice. If you want, I can connect you to a counselor who can help you with to get over all this. How's the baby, Alice?
My baby is fine, doctor.
Okay, what have you named the baby?
He's John.
Joy. And are you breastfeeding?
Oh, yes, doctor, I'm breastfeeding.
And who is taking care of the baby these days?
Actually, that is another problem, and that's the reason I'm not joining also. Nobody is there to take care of my baby.
Okay, so maybe I can connect you to help with this also, Alice, if you want. Will that be okay?
Oh, that will be great, doctor.
Sure. So, Alice, currently, do you have any problem with your waterworks or bowel?
No,
Any bleeding issues from the wound?
no.
Has your wound completely healed?
Yeah, I told you, the midwife seen me in the community. She said that it's healed completely.
Okay. And have you regained your periods?
No, not yet.
Okay. Some questions may be intrusive to ask, but I would like to ask you, so do you have pain at the start of the intercourse or deep penetration?
In the initial time only, I just got freezed. He tried with some lubricant also. But then I just freeze, doctor. I can't help it out.
Mhm. Must be difficult for you. Any history of sexually shared infections in the past?
No,
No? Okay. And any medical illnesses for which you're seeing your GP for?
no.
Any surgery on your tummy or down below?
Yeah, I had a keyhole surgery for this cyst. My ovaries had a cyst, so it was long back, but that was uneventful.
All right, I'll note it down. And any family history of concern?
No,
Some personal questions. Do you smoke
no,
or do you take alcohol? Any recreational drug use?
no,
Okay. Are you allergic to anything?
no.
Okay. And what do you do for a living?
I am a nurse actually. I am technician in the blood bank in the same hospital, doctor.
All right. And do you feel well supported?
Yeah,
That's nice to know. And how have you been feeling lately in the past 4 weeks
actually, that
overall?
I just told the doctor that my delivery experience was not that pleasant. So yeah, I do get sometime nightmares regarding the delivery experience.
I can understand, Alice. If you don't mind, I would like to examine you in the presence of chaperone to have a look on the current status of from and to look for you from down below and to see the current status of the wound of the tear. Will that be okay?
Okay.
All right. So, Alice, I have examined you, and I can see that the healing is complete as like the midwife informed you earlier also. And what I can see is that you may be experiencing this painful intercourse because as a result of the healing process, because since there was extensive tears, as you said, so there is a formation, sometimes a formation of a scar tissue, and this scar tissue actually constricts the vaginal opening, and as a result the opening becomes narrow, and with that there is a complete difficult there's basically difficulty in the intercourse. In your case, what we can offer you is, as you said, you have tried gels and lubricants. This is the first thing that we offer, and there sometimes you can use those before intercourse. Sometimes there are dilators available. They're made up of plastic and natural molds also. You can use those dilators, and with time, this scar tissue, the narrowed constriction rings becomes widened. Are you with me, Alice?
Yeah, doctor.
Also, you can use
But
some
doctor,
natural oil.
actually, I'm afraid of putting anything inside my vagina. I feel that it will tear off my vagina. So I'm afraid of putting anything inside my vagina.
So, Alice, see, I know you're going through a tough time. I can, provide you help with connecting you to a psychosexual counselor. With if you could take sessions with from the counselor also, that will also help you. And then you can later on try on these lubricants and dilators, and even massaging with the tea tree oil and almond oil. This will stretch in the vaginal canal. Are you with me, Alice?
Oh, yeah, yeah, got it
Yeah.
out.
And even the perineal trauma physiotherapist can also help you. So the counselor, the physiotherapist, with multiple sessions with those, that will definitely help you. If all these measures don't help, then there is a surgical procedure done, which is called Fenton's procedure, and that will only help once you actually take out that fear of insertion of anything. And do you want me to tell you more about this procedure?
No, doctor, it's okay. But can I do go for cesarean section in my next pregnancy to avoid all these things? I'm really scared.
See, Alice, that's obviously your choice. You can always opt for a cesarean section, but with the coming pregnancy, you can, if the trauma heals, if you get over from this, then you can always try for a normal delivery. This is not something that can cause any problem.
Okay.
Are you with me?
Yeah, I am with you, doctor.
Yeah, so Alice, I'll connect you to the psychosexual counselor and also the perineal trauma physiotherapist. They'll help you with it. Once you're done, then I'll also give you patient information leaflets. I'll write back to your GP and also arrange you a consultation with my consultant also, and that will definitely help you.
Okay. Okay, doctor. That's it.
Okay. Thank you.
Okay. So, your own reflection regarding the task. Anybody want to say comment on her presentation? There are many first timers, I think, today. So I would like to take the introduction from them. Okay, but after this. So your own reflection regarding your task, dear Samaya. Sumaya or
Sumaya.
Samaya?
Yes, Sumaya. Yes.
Okay, Sumaya.
I could not satisfy my patient. I could get that because of I thought because of the fear of not doing the sex of because of the perineal trauma. I think the only thing that came into mind was the physiotherapist and the psychosexual counselor help. What else could have I offered her?
No, it's okay, dear. You could able to offer me, means I don't think there was any the way you had started, the way you had continued. That's okay. See, it's not a acute thing where you will be satisfying me suddenly. So that you
Hmm.
need to tell me somewhere somehow. You just need to tell me that we are not going to get a result or success in one go. It's a slow
Yeah,
process. So if you would have told those two, three things now, I would have been okay. I would have accepted it. Hmm?
right.
Okay.
Yeah.
Okay.
Rest, I
Uh,
think the history was,
no,
I
it's
think,
okay. Yeah, it's okay. Means I am okay. I will pass you clearly in this case. Okay, but we will go in detail. Anybody wanted to comment what she missed out, what she has done good, what she needs to be improved? Anybody, please come up, come up, come up. Listen to the, give comments, participate actively. Don't be a listener, okay?
Ma'am,
Hmm.
some histories are repeated, otherwise, she presented well.
Hmm.
And going as a couple together,
Is
and
very important.
yeah,
Very
and
important.
mm,
Hmm.
going as a couple, go for counseling helps in foster healing, but it takes time.
Yeah. So
It is
that
curable.
totally, yeah, it is curable. That is reassurance. You offered me reassuring words actually. Okay. Somewhere, somehow you were trying to reassure me. But at least you should have told me that this is a long process. We will not get results in one go. We'll take some time. So those two, three sentences, I might have been satisfied. Okay. So this it is treatable. I will get treated, but I will take some time. The options you have given me completely. The when I told you that afraid of having that tear in my vagina, if I will put out anything, including the vaginal dilator or even penetrative sexual course intercourse. Here also you could have acknowledged. I just wanted to reassure you that nothing will cause any trauma to your vagina or your vagina. Okay, not even penetrative sexual intercourse, not even vaginal dilator, and we will be using lubricant. Okay, so these fears will be, you offered me psychosexual counselor at that point, very rightly you offered me the counselor, but one sentence that no, not, these things will not cause any trauma, and that is a fear what you are having in your mind. To get out of that fear, we will offer you psychosexual counselor. Okay, so this way if you would have convinced me, I would have been more impressed. Okay, more impressed. Overall, you have presented very nicely. Your way of communication, your way of empathizing tone, all those things are very good. Okay, so overall it's a clear pass. There are two three points. So Muthulakshmi has already pointed out 3 points. Anybody else wanted to say anything?
Then, regarding that perineal tear, so she should go to the perineal clinic to check for any residual defect or
No,
any
no, no. It is
symptom.
healed. It is healed. It is healed.
Okay.
Okay, so that
Oh,
perineal tear has been healed. The community midwife also has been seen her. Okay, okay. Anything else? Anybody can comment on anything, anything if somebody is picking up.
and it is the first time she is experiencing, or she had it before. Yes.
Yeah, that primary dyspareunia or secondary
Second.
dyspareunia, she missed out on that piece of information.
And we could have told that because of the fear of vaginal tears, or she might be feeling like this. So,
What?
no, because of the traumatic, the dyspareunia, maybe because of the traumatic childbirth, so she's feeling that again she will get tear. So, in that feeling, she's
Mm-hmm.
having dyspareunia.
Yeah, so that thing was not actually right. Okay. Okay, so whatever thoughts are coming to your mind are just time being. So, once things get settled, okay, once things get settled, we will discuss about your, and once you will be pregnant next time, we will be discussing about this. Okay, so that will be a more feasible plan. Okay, very nicely acknowledged. Okay, very nicely acknowledged. Anybody else wanted to say anything? No. Okay. Now, none of you has acknowledged she is a technician working in your hospital. She had come to discuss a very sensitive topic which she has signposted lately.
Yes.
Okay, signposted lately, and she had come to discuss about dyspareunia. So, what is more important here?
I think that
Confidentiality.
confidentiality.
Initial thing only, it's like we can tell confidential. I am aware of your situation. We are here to help
Yes.
you, and whatever we are talking will be kept confidential at the start of the task.
Although the answer key is not including it in this task, but that is very important. Huh? Yes or no?
Yes, ma'am.
Yes, yes.
So that thing has been missed out. Very good start. But if you would have assured me about confidentiality, okay, then it would have been the
Right,
best
right,
task.
ma'am.
Okay, best task. So that is patient safety points because she's working. They had mentioned you. She's working technician in your hospital laboratory. Okay. GP letter. Very nicely you introduced yourself. You asked me permission. Just wait. Okay, so very nicely, introduction was very nice, situational awareness was very nice, setting agenda was very nice. You forgot to ask me concerns in the beginning, but it was a straight station actually. Looking at it was a straight station. Confidentiality, you needed to ask me. There are five domains being assessed, okay, and four things they had asked you to do, okay. Obtain focused history, discuss possible causes. Hmm? Discuss possible causes, okay. So you discuss with me only one cause that might be a narrowed vagina. Hmm? Yes or no, am I right?
Yes, yes.
Okay.
I should have
Outline the,
discussed more.
yes, it is a task for differential diagnosis. These are there are certain tasks where you need to give the differential diagnosis. Hmm? So do not go on one line. Okay, so that's the reason few history is very important. Then outline the management plan and answer the queries she may be having. So three tasks you had completed. This one task you have not given. Differential diagnosis you need to give. Okay. Um, all five domains we will discuss in the thing. So you offered me counselor regarding my difficult delivery, traumatic delivery. You asked me regarding my baby, breastfeeding, baby's name, bowel bladder. In the bowel history, please ask in this dyspareunia task constipation. Any history of fissure. Okay. Because that is one of the important, sometimes it is one of the important, the patient might be having fissure. Okay. Constipation, fissure, and that could be the leading cause of her dyspareunia. So please ask whether there is any history of constipation, bowel symptoms specifically. Sometimes a vague bowel symptoms they might not be telling you. Okay, so any bowel symptoms, especially constipation. This is just an explanation. Then you asked me regarding the dyspareunia, whether it is superficial, whether it is deep. But another question is primary or secondary. Prior to delivery, was it there? Any, if you want to dig out little more history, that tampon smears are very important. Whether you had undergone smear, whether there was any difficulty in introducing tampon, that is there. Rule out deep dyspareunia and superficial. Any history of abuse. Okay, dyspareunia always rule out. Medical, surgical, allergy, support at home. Hmm? We just need to ask this history. You took little longer time to ask the history. It's almost 6 minutes, dear. Because yes, I had to debrief you regarding my experience. So I took also one and a half minute time to explain you regarding my labor details. But still, I feel you could have finished it off by 5 minutes. Okay, so see to it how we can reduce it out. So keep your am agenda set very short, very crisp. Okay, so I am aware is you mentioned everything about aim, but see to it how we can reduce it because it is very important to have at least 5 minutes 30 seconds to complete your task for counseling. Then you offered me examination. You had asked the relevant history. There wasn't any irrelevant history per se. Mm, then you explained me why it is narrow opening. Did you check what is this? This is secondary dyspareunia. Okay, so you explained me that this is secondary dyspareunia. Have you heard about this? That is checking background knowledge about the condition is very important. That is communication with patient, also information gathering. These two things will be addressed in the same question. It will be many a times come, it will checking background knowledge, these simple things give you pass in two domain. One is information gathering and another is communication with patient. So do not miss out, okay, whether she is aware of, okay, you need to ask. uh, did you mention examination in the presence of saffron? I didn't listen that point.
Yes, yes, I did.
Okay, then it is okay. It is okay, okay. So you missed out on checking background knowledge. You just gave me a narrowing of the opening because of the difficult delivery. Yes, that is a possibility. That is a possibility because of the scar tissue. But then the other possibilities cannot be ruled out. So we need to give them a differential diagnosis here. Reassurance you mentioned, but you would have mentioned, okay, so this is going to take some time. The management was perfect. You need to go for a uh, you need to involve your partner, psychosexual counselor, massaging, then vaginal dilator, pelvic floor muscle exercises, relaxation techniques. You can add little more that foreplay. She can start with foreplay, and that more reassurance regarding my fear of getting my vagina teared off with the use of vaginal dilator or penetrative sexual intercourse. That one thing was missing out, and then you close the station. Hardly you went 1 minute overdue. So okay, so that time management in the history, if you could able to minimize it, it will be very very good. Now coming to the feedback, okay, or answer key, my answer key, we had given feedback. Confirm, sign introduction, signpost, assure confidentiality. Just wait. Okay, so asking concerns, set that signposting, assuring confidentiality is very important. Aim of consultation, ask concerns, a straightforward station because it has been mentioned very clearly. Open question, always start by open question. Let the patient explain everything. Acknowledge what difficulty she is having. Use some reassuring word which you had used, and here you just need to tell her that yes, a few women experience this kind of problem after the traumatic delivery, but it is treatable. Those one or two reassuring sentence will ease out, okay, will ease out the patient. Then delivery or labor details. Here what actually happened, Saima, you started asking me three questions in one shot. How was your labor, how was your delivery, any instrumental delivery? Okay, so ask one question. You need to practice that basically, okay, not to bombard with multiple questions. Yes, so can you just tell me in detail about your labor? One question, she would have given you complete details. If she would have not given you, you could have asked her regarding the type of delivery, what delivery she had, whether it was instrumental, whether there were any tear. So those were the closed question if I had not given you any information, okay? Remember that, not too many questions. Then you had offered me counselor. Baby breastfeeding has been asked. So this is something a little bit up and down history, but I will not say means there is no harm in asking details in any sequence. In any sequence, you just need to kickbox that information, what whether you are asked or not. So deep and superficial, you asked. You didn't ask me whether it is primary or secondary. That also you need to ask. What treatment she has tried, whether there is any strain on the relationship. That is also we need to ask. Mental history, you asked. Okay, I am not mentally it is not bothering me mentally, but yes, I am worried. I am having some difficulties. I do get nightmares, STI, bowel, bladder, whether she is on any painkiller, especially like codeine, because that causes constipation, might be the fissure in ano, or something like that. As GP has not GP has not examined, ask her about abuse. So that is, my sequencing has changed here. Any past sexual traumatic experience, you can ask her. Access her case delivery notes to see what type of tear she had. Okay, so you can ask. Baby breastfeeding, she's breastfeeding, the baby is fine. Bleeding, she's no bleeding, not get any menses. Contraception, very important whenever post delivery patient comes to you. Okay, so you can just guide her regarding contraceptions, it's very good. Okay, and complete the history again, medical surgical. Examine in the presence of saffron. You can check for, you can just tell her that I wanted to examine you to see whether there is any dryness in the vagina, whether there are any fissure, and would like to see the scar of episiotomy. Okay, fissure in ano. Okay, whether there is any tear in the rectum or anus, that is called as fissure. Fissure in the anus, you can explain her whatever findings. It was mentioned that the scar has healed completely, so you can just tell her that okay, if they had provided you, it's okay. If not, you can just offer examination. Since they had not provided you any examination finding, you do not assume that it has been healed completely, because you assume that it has been healed completely as per the midwife. Here you can just tell the examiner what you wanted to see in her case. I would like to see whether there is any dryness into the vagina due to breastfeeding, any fissure in ano, and how is the scar of episiotomy. That's it. You are going to, because you are keeping your differential diagnosis in mind, and just you are telling what examination you are worried, you wanted to know in this case. Explain, if you are provided with some certain examination findings, then explain that finding to the role player. If not, then you just tell her that what you are having is a secondary dyspareunia. Have you heard about it? Checking background knowledge. If not, pain and soreness after delivery is known as, or after childbirth is called as secondary dyspareunia. Many reasons. Might be a difficult delivery, some bladder or bowel problems. Okay, basically, that fissure in ano is one of the common problem. Lack of lubrications due to lack of hormone estrogen. Lack of desire of sexual intercourse due to knee responsibilities. And the reason what you had given, that the narrowed vagina because of the extensive tear inside your vagina, could be the reason for this. Many reasons. Okay, but it's a it's treatable ultimately. Although we are seeing this condition commonly, but it is treatable, will take some time, and we need to involve people. So your partner, consultant, physiotherapist, psychosexual counselor. So this is something like a MDT, a local MDT. If nothing will work, that freshening of the scar will be the last thing what that will be decided by the consultant. It will not be. So now what next? Go slowly. Pelvic floor muscle exercises or biofeedback. Use of massage techniques, seeds bath. Use olive or coconut oil, whatever oil you can use here. Explore concerns. So here again, I am having a concern that it might damage my by intercourse. So here you just need to tell her that no amount of penetrative sexual intercourse, not a forced sexual intercourse. Okay, forced sexual intercourse will cause a trauma, but a simple penetrative, mutual penetrative sexual intercourse, any vaginal dilator, will not cause any further damage. These are the fears, these are the anxieties what she's having. For that, she can take a help of psychosexual counselor, and she can also take help of her husband, because it is very important for her husband to be a part of her treatment. Okay, uh, if you want to explain any findings they had given you, use drawing. It's always better off to explain the drawing. Also, massaging your private parts or vagina at least for 3 to 6 months. You can here, you can involve your partner, so that mm, what you can say, that foreplay means they can involve themselves in some kind of foreplay. So that is also they are suggesting in many dyspareunia you videos. So that is one technique. Then if everything has tried and not help it out, then Fenton operation. Okay, so Fenton operation basically refashioning the scar or removal of the scar tissue, but it's a surgery. Sometimes it will cause more damage than giving us a result. So we just need to tell her that that will be the last option, which will be decided by the consultant. And with now what now she needs is psychosexual counselor with physiotherapist, and the physiotherapist will decide whether it is biofeedback or a vaginal dilator which she is going to need. Okay, so here you can end the task, but I do have these two questions. Okay, whether I can go for LSCS, uh, rather than offering her LSCS straight away. I will definitely say that at that time we will discuss both the options, vaginal delivery and cesarean section with you, and pros and cons of both the options, and whichever you find suits you better, we can opt for that. It's her autonomy to decide for herself, but do not say right away because it is too early. She is in a phase where her anxieties, her fear is taking a big toll. Okay, once she will come out of this fear, once she is coming out of this means anxiety, she will able to think about herself in a proper manner. So as of now, just reassure her that yes, your fear and anxieties are acknowledgeable. It is too early to decide regarding the next pregnancy. Let's treat these problems as of now, and we will discuss about your next mode of delivery next pregnancy. Okay, offer help and counselor. Okay, patient information leaflet, I didn't get time to put search any support group. Okay, but any support groups will that birth trauma association is a support group where any birth related traumatic experience they can share. So that birth trauma association, post delivery complication cases, hmm, you can at least offer them this. Okay, so this is my support group for this case. Patient information leaflet regarding the dyspareunia or secondary dyspareunia, you can explain her, and we can see her in the next meeting with the consultant, with her partner in the consultant's presence. Okay, so overall a good presentation. I do not have much to say, only few points missed out. So review details of pregnancy and operative delivery. So accessing case detail is very important. Ascertain the psychological impact of traumatic experience. You ascertain me. You had you also explore the potential impact of this on her fear and penetrative sexual intercourse. Indicate that the notes of her delivery will be have been reviewed to have a better understanding what exactly had happened regarding the repair. Justify to need for examination. You examine me and identify the fact that she is not having anyone at her home to support with her newborn care, and when she wanted to go for work. Okay, communication with patients, so it's clear pass in information gathering because you took long time also to collect information gathering. Explain the need for in this case actually this is only psychosexual history, dear. Okay, in this task of dyspareunia there is no need of taking this medical surgical history. You just need to take a psychosexual history and max to max mental history. So psychosexual history will definitely include your abuse history, bladder history, bowel history, uh, primary dyspareunia, secondary dyspareunia, baby breastfeeding. Because if it is breastfeeding, then that lack of estrogen is also one of the reason for having this dry vagina, giving a dyspareunia. Explain the need for examination in details, what to expected in examination, possible causes for painful sexual intercourse, trauma from bad birthing experience, scarred or narrowed introitus and vagina, attempts to counsel and provide reassure that this is not an unusual will be addressed, fear of damaging the vagina will be addressed, and encourage involving husbands at the next visit. Communication clear, this is also clear pass. Communication with colleague, refer to psychosexual counseling. Involvement of perineal trauma team in counseling and management. Yes, this has been mentioned here actually, Muthulakshmi. You can involve them. Okay, perineal trauma team and counseling and management, but that psychosexual counseling, pelvic floor muscle exercises, your consultant, these people will form a MDT and they will be involved. Patient safety, confirm details, empower patient to make an informed choice, appreciate and takes into consideration her fears, discuss any potential safety of any medications to be used on breastfeeding. Here we are not using anything. Allay her fear. Basically, counseling using a warm, welcoming words, some reassuring words to this patient is basically a patient safety. To support rather than judge her fitness to be a mother, address her fear of another vaginal tear, signposting confidentiality or certain any drug allergy. Okay, so this signposting and confidentiality, here only I might be giving you borderline. Apart from that, all everything I'm giving you clear pass. Okay, explain that scarring is likely contributing factor, assure that healing is complete, and the risk of tear with penetrative intercourse is minimal. Forced penetrative intercourse, yes, there might be chances of tear, but a mutual penetrative sexual intercourse, no risk, any means there is a minimal risk of tear. Offer the use of lubricants, even dilator, if the scar is considered the major problem. Offer Fenton repair, and that will be the last resort, which will be decided by the consultant with pros and cons. Refer to clinical, psychological, or psychosexual counselor, and recent knowledge about perineal trauma. So this is clear pass from my side. Anybody is having any question? Anybody? Okay.